so much for joining us for the Mpox and Marburg special briefing from AfricaCDC. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Our main speaker for the session is Dr. John Kaseya, the Director General of AfricaCDC, and we are also joined by His Excellency, the Minister for Health for Rwanda, Sabin Nsanzimana. I will now pass it on to the DG to start the session. Over to you, DG.
Good morning, good afternoon, good evening to all of you. Thank you for taking this press conference today. We are glad to be joined by Honorable Minister Sabin Nsanzimana, who is leading the Ministry of Health in Rwanda. As you know, we are facing two major outbreaks in Africa today. We have the Mpox and we have also the Marburg. And the minister will take the lead for the Marburg outbreak and will give us more perspective and will then come to provide the support that AfricaCDC and all partners are providing. Let us start with the PowerPoint quickly. I will not talk too much about the epidemiology of Mpox, just to give you a highlight. Next slide, please. Just to share with you, unfortunately, we have a new country that declared Mpox this week, 38. This is Ghana. That brings a total of 16 African member states affected. And you will also see that if we compare the same period, 38, 2023 and 38, 2024, there is an increase in terms of cases of 201%. It means the outbreak is still not controlled. Next slide. And in terms of new cases, I think for the past 4 weeks, you see the same trend. It's like we are having around 2,500 new cases per week. And we still have a number of deaths. You will see we are not more talking about confirmed cases because the testing rate is still too low. And you'll see it in the next slide. Next slide, please. If you see that slide, you a country like DRC, Congo, and some other countries like Liberia will see that the testing rate is still low, while we have other countries performing very well in terms of testing. But even if they are performing well in terms of testing, we can see the positivity rate is still low. That is bringing a number of questions that we discussed last time about how the sample is collected, how the sample is transported, the quality of the person doing the testing, and so many other questions. Next slide. We wanted to zoom on on one particular city, Kinshasa, because that one becomes a situation that must alert all of us. You'll see from week 1 to week almost 26, we didn't have clade 1B detected in Kinshasa. The first one was in around week 27. But after the 27, from week 29, we started to see slowly an increase with a peak the week of 33, 34, 35. In summary, this is when children resume the school. If someone wants to know if there is an impact of resuming school in September in Kinshasa, this is what we have as evidence. But we also see that there is a decrease and we'll discuss about what DRC they are doing, mostly in Kinshasa, to stop the spreading of this outbreak. Next slide. We already discussed this issue of increased cases in Kinshasa. We discussed the issue of the testing rate and the positivity rate. We also discussed the issue of the surveillance system that is weak, and we don't get on timely mode all reports that we are expecting from all regions and zones. Next slide. Quickly, in terms of a response, this is what AfricaCDC and all partners under the IMST, WHO, UNICEF, and all of us together, this is the support we are providing to countries in terms of reinforcing surveillance, deploying the test kit for our countries. As you will see, almost 18 countries were targeted for training, and 25 countries assisted with lab capacity. And we are also providing support for case management because we need to reduce the number of deaths that we see. Next slide. Yesterday, there was a meeting of the emergency consulted group. That is the group that is advising the AfricaCDC on the way to manage the outbreak. And our African experts were joined by international experts like Professor Anthony Fauci from the US, like Peter Piot from Europe, and other experts. What we got from them first, they supported this joint approach that we have currently in Africa with one continental incident management support team. And also they wanted to extend the mandate of this IMST to Marburg, because we have almost around 27 partners sitting in this IMST, supported by almost all donors. And this is the opportunity for us to advocate for more funding also for the MAP to stop the Marburg in Rwanda. We also discussed the issue of research and development, and also involvement of communities by putting in place strong community-based surveillance. And we discussed also how to accelerate with vaccination. Next slide. When we talk about vaccination, let me inform you that tomorrow we have vaccines landing in Rwanda. We'll start with 5,000 doses, but we can increase the doses because Rwanda was the first country starting with vaccination. And we also know that DRC will start in 2 days, and Nigeria will start on the 8th of October. We really encourage all countries to start vaccination against Mpox and to unlock some doses made available to us by partners. Next slide. We already discussed the research that we are conducting. There are so many research that are ongoing because we have so many unknowns about Mpox. And we are also testing some medicines. This is something important for us. The team will come and provide more information. What is also critical for us is to test what we call the fractional doses of vaccine. That one will help us to have 5 times the quantity of vaccines to be administered to our target, because we can divide each dose by 5 injections. I think we can also discuss that if there are some specific questions, because this one will be a game changer from 5 million doses that we have today. we can multiply that by 5 to have around 25 million doses that can be available for people in Africa. Next slide. In terms of funding, as you know, last week was a successful week. We managed to raise around $1.1 billion. Out of that, 500 came from the US, 129 came from Pandemic Fund. Even the minister, Sabin, who's with us today, is the person who's co-chairing Pandemic Fund. If there are questions about Pandemic Fund, he will also be able to answer. And we have also CEPI that provide around $217 million to support the local manufacturing of vaccine, and other partners who provided funding. We still need more funding to strengthen our health and surveillance systems in Africa. And you will see that with the Marburg when the minister will speak. Next slide. I will stop here. I will hand over to the minister because Marburg is a major focus for us now. And Minister, over to you to take the floor and to lead us on. Please bring back the slide. I don't know if the minister, do you have a slide or you want to build on that to continue?
I will speak.
Okay.
I will speak because I have probably more updates as of this morning. Thank you, Director General, AfricaCDC, Dr. Jean Kaseya. Thank you so much, Margaret, for hosting us. And all the colleagues at AfricaCDC, the media houses representatives. We're very happy to be invited to this discussion. It's a first time for me to be on this platform with AfricaCDC and with all of you. But Dr. Jean Kaseya had invited me previously, and that was during the Mpox outbreak, the very early days, and also when we started vaccinating for Mpox. Until 7 days ago, when we confirmed our first case of Marburg virus, which triggered immediate response from our system, but also from our partners. And I want to highlight that AfricaCDC has been the first to deploy the teams. And as we speak, they're already on the ground. And we want to say that this partnership, together with other partners who are also joining from different places of the world, we are going to stop this outbreak before it affects other places in the country, in the region, or even beyond. So I would like to start by saying that this virus, Marburg virus, is known to be associated with very high mortality rate. If not the first, maybe the second deadly virus that is so far known in terms of affecting people's body and destroying immune response and leading to mortality. And it's also known to not have proven vaccine so far. They are advanced vaccine in the market. Therapeutics as well. They are not yet specific treatments for Marburg vaccine viral disease. And the treatment being provided are more supportive, but there are more advanced products and therapeutics that we are looking into, and some already in country, and with that we are providing to our patients. So the first time in our history to detect this virus, as you can imagine, while we're responding to Mpox, was stressful. But we've been training our teams and ourselves through other outbreaks and pandemics, such as COVID-19, that it wasn't a surprise. We are all expecting outbreaks and pandemics at any time. There are alerts all the time. And that explains why we need to be prepared and we need to work together. As of today, we've confirmed 36 cases of Marburg. And unfortunately, we've lost 11 people. And more than 8% of these cases are healthcare providers. And that is how we got to know this virus was there. It's very particular for the outbreaks. Most of them are detected in health facilities. And the healthcare workers, most of the time, it's unfortunate, but it's a reality that they are the first to be affected by such diseases because they first sick people from different places, different backgrounds. But also it explains how healthcare systems that have been built in Rwanda are also allowing people to be referred and get to facilities and be received and treated. And our surveillance in the hospital that was attending the first suspected cases raised the alarm, saying we're seeing patients, 2 cases that were not responding to usual treatment because the symptoms for Marburg are very similar to malaria. It's high fever, is a severe headache, is muscle pain and joint pain and fatigue, and later on gastrointestinal nausea, vomiting, that are very particular, very well known for malaria. For malaria endemic countries, this is a very typical definition of a malaria case. And in actually what was also confusing is that these early cases had also malaria confirmed positive, which means you may have malaria, also have something else. You may have other disease. Co-infections are also common. For some, wasn't malaria confirmed, but you may miss malaria and have something else. So because the patient we're talking about, the very first case to investigate, was getting sick very quickly, the Rwanda Biomedical Center, the National Public Health Institute, and the National Reference Laboratory were called to investigate and even take samples. And that is how they run different panels of tests, including multiple viruses, pathogens, and all became negative at the end. Marburg was confirmed for the first time in Rwanda. So we started responding, as I say, with contact tracing, mostly among healthcare workers. And this is a disease that develops symptoms generally between 2 to 3 days earlier and up to 21 days. And that is known as incubation period for Marburg, but also for some other viral diseases such as Mpox. It's very typical incubation time for most of these diseases. So as we speak, is already 7 days. We went back to trace contacts. Some have developed symptoms and tested. And that's why in the last 7 days, every evening, we've been reporting data on confirmed cases and also in treatment centers, what we are seeing. And unfortunately, it's a very aggressive virus that destroys the immune response and affects organs, multiple organs affected very quickly. And that has led to losing lives of those healthcare workers and some others, non-healthcare workers. But mostly that is where we've seen number of contacts, more than 400. We've been following. Some tested negative, some had no symptoms, others had. But the test PCR is the determining factor. And I want to clarify here, contact is not a positive case. A contact is someone who has been in directly or indirectly closer to the confirmed case. And the more contacts you explore, the better, because you exhaust all possibilities of the virus or the outbreak to spread. We have also increased our testing capacities because the PCR testing, there are not yet other rapid diagnostic tests on the market. This is a rare disease, but very deadly. And sometimes this explains also on the manufacturing and research front how things have not advanced that much. And it's very unfortunate that we still have these gaps in terms of research and development. And this should be a call for action that I want to make first, that we should advance science, manufacturing, local manufacturing, and also development to handle these outbreaks that have been present in the region. And last year it was here in East Africa. We had the same, another outbreak in a neighboring country, and maybe next time could be in another place. So this is really important. So in terms of treatment, we are also working with our teams here. We've been treating, learning a lot, and good news that some patients are improving. Some have already had their first test negative. Already counting 5 who tested negative yesterday. We're doing a second test to see if they have cleared the virus after this first week. It will be the first good news, because the last days was more of announcing those who were not able to get this virus cleared, but rather lost their lives. So we're working on the community awareness and intensifying education on this virus, because people confuse sometimes COVID or Mpox with Marburg in our context. Handling 2 outbreaks at the same time, it's not an easy thing, but we're balancing, expanding our team, but also having this support from our region. I mentioned AfricaCDC. There are others, US CDC, WHO, and also from other friends. I've been talking to my brothers and sisters, ministers of health, and Dr. Jean Kaseya has also actually called to actions through different interactions. Dr. Tedros and others who are with whom we've been very close. They're friends in Europe, in America, in Africa. So we see that solidarity coming together, and we want to highlight this, that the best way to end any outbreak is to work together. So I would like to conclude by saying that this Marburg is one example of how, as a continent, as a humanity, we have threats all the time that could emerge from anywhere. But we have also that strength and capabilities to respond quickly by putting all our means together to be advanced, to be ahead of the viruses. And the faster we act, the more lives we save. And it's not about the how much or who you know, it's all about how we are all concerned. I will pause there and take specific questions if we have. But I want really to thank everyone who is supporting Rwanda to fight Marburg outbreak. I thank you.
Thank you, Minister. Margaret, maybe before moving to questions, I saw that you wanted us to have 2 hours today, because we have the minister, we are talking about Marburg, and we have also Mpox. Let me first congratulate the leadership of the government of Rwanda and my brother, Minister Sabin, on the way they are managing this outbreak. The first call I got from Minister Sabin, it was when he was landing to Rwanda from New York and informing me from the airport that we have an outbreak. Immediately, we started to deploy colleagues. The next day, AfricaCDC colleagues landed to Rwanda, and started to work with Rwandan colleagues. I think this kind of leadership is helping us. All partners, when we are coming, we know that we are building on that. Thank you, Minister Sabin, and please convene that to His Excellency, the President and or the whole government. The second one, I want to say, I have decided to cancel my attendance to the World Health Summit in Berlin next week because my priority today is Marburg in Rwanda and Mpox. I will be in Rwanda beginning of next week and to work together with the minister and all partners under the incident management support team that is in place to see how we can provide youth support to stop this outbreak very quickly in Rwanda. The third one, because we are flying to Rwanda, it's a clear message that there is no travel ban policy. AfricaCDC is not calling for that because I received so many messages. We are flying to Rwanda, we'll be in Rwanda, we'll be attending meetings in Rwanda. It's an outbreak that is managed, and as we have outbreaks in all other countries, then there is no travel ban, and I repeat it. And the fourth one is about the aggressive fundraising that will start by maybe tomorrow based on the response plan that is finalized by the government with support from all partners. And we are waiting for this response plan to be official, and the mechanism that we put in place for Mpox, as I was sharing with you, managed to raise $1 billion for Mpox. We can raise more funds also for Marburg, because this is time for solidarity, especially when we have strong leaders showing the willingness of Africa to stop with all outbreaks. The last point is about local manufacturing. Marburg is again, in addition to Mpox, in addition to COVID, is again an alert. As the minister said, there is no rapid test. It means even to conduct this communities-based surveillance, we need to have PCR. But that one, we can start quickly to conduct some research and to develop some rapid tests. Also, we need to have more capacity in terms of testing. The government of Rwanda ordered 5,000 test kits. AfricaCDC ordered 5,000 test kits. I think all of these test kits will land in Rwanda this week and by end of this week. But we cannot continue like that. We need to order this test kit from Africa. And this is a clear message. We are working strongly on that. And the last point is about therapeutics. I think the minister told you, we are working closely together, and maybe there will be a joint statement that will be released between the Ministry of Health, Rwanda, a company called Gilead, and AfricaCDC on the donation of an antiviral drug to, even if it's not 100% confirmed, but we know that we have evidence that this drug is treating the disease. And we'll do everything that is possible. Even for vaccine, the minister is talking with a number of partners. We are talking with a number of partners to see how we can accelerate the development of vaccine against Marburg. I will stop there by saying that we are doing our best. The country, AfricaCDC, and all partners will need more to stop this outbreak. Over to you, Margaret, for questions to the minister and ourselves.
Thank you, DG. Let's cross over to the floor. I have Kai from the US Journal of Science. You have the floor.
Thank you very much, Margaret. Two questions, if I may, to the minister. So one is, can you talk a little bit more about the index case? when exactly did the index case die? And what was the location? I've heard King Faisal Hospital in Kigali mentioned a few times. Just trying to understand a little bit better the timeline of this. So anything you can talk about there would be really helpful. The other question, obviously everybody's interested in getting vaccines and therapeutics, experimental vaccines and therapeutics to Rwanda as fast as possible. I understand that you've designated 2 investigators to be the principal investigators for the 2 protocols on vaccines and therapeutics, and that the next step would be to submit the protocols for approval to the NRA and the ERC in Rwanda. Just curious where that stands, what the timeline is on that, and what the issues are that need to be kind of ironed out before these things can take place. Thank you.
Thank you. We'll pass on the mic to the Honorable Minister for the 2 questions. Over to you.
Great. Thanks so much, Kai. The 2 questions are important. The first one on index case is still an ongoing effort to determine exactly whether the patient 0, the first case. But what you rightly mentioned, these first tests and confirmation were happening because we've seen in 2 major hospitals in Kigali that our patient being attended and also care workers who were helping the intensive care unit tested. And we managed to know, unfortunately, when the patient has died, but also consequently the healthcare worker who was attending and those the close contacts and all the numbers I mentioned. So at this point, it's very hard to tell what the index case. We are conducting different levels of sequencing and to determine exactly where the virus started. And it may not be concluded soon, but we are highly interested to know so that it can help also to trace more and also to be prepared. But this is question sharing, and we keep also updating as we know through this process. As you can imagine, going back when even some lives have been lost is not an easy process. In terms of protocol for trying new therapeutics and vaccines, all these protocol were finalized and submitted, and our national review, regulatory and ethics have already provided approvals, and we should get this product in terms of days. So we look forward to begin very soon. Actually, it should be, if nothing changes, when we meet again next week, we'll be updating you on where we are in terms of launching or progressing on these 2 important products, therapeutics, particularly monoclonal antibodies, as well as vaccines.
Thank you, Honorable Minister. Let's take the next question from Kerry of Health Policy Watch. Kerry, you have the floor.
Thank you so much. My question is also for the Minister, and it's also related to the index case. I just wondered, because there are those 8 districts that are quite far away from each other, whether you thought that maybe people came to Kigali and then they went back home with the infection, whether that is what you're thinking. And then also, I just wanted to know a little bit more about the donations of this antiviral drug from Gilead. How much and who is getting it? Thank you so much.
Thank you. Let's move on to the question.
Okay, great. Thank you. So Kelly, thank you so much. I think we want actually to provide accurate information here, because the map that was shared was not speaking to the truth of the cluster we're following. This was interpreted as 7 districts affected by the virus. And this was not an official publication of the Ministry of Health or Rwanda Biomedical Center. And the district where were marked actually in that specific report explained the tracing of contacts that are all linked to the main cluster in Kigali, the hospital that we talked about. I'll give you an example. One district which is bordering DRC in the west north of Rwanda was highlighted as an affected district because there was a contact of a case in Kigali that had traveled, and we had to track that case back to that district. So in short, we have this one cluster in Kigali in a specific ICU center in a hospital that had contacts, and all these contacts being traced have been highlighted in the map that you saw, which is not unofficial, and it should not be considered at all because it doesn't explain exactly what is happening on ground. And we'll be happy to share exactly how this work is being done. And I like how you put it in the context. These districts are far away from each other, but we are talking about a healthcare provider who was in the same hospital where the case was first confirmed, who traveled the day after and was traced during our contact tracing to make sure is isolated, tested, and the contacts are also followed. It's not an isolated cluster. It's more of contact tracing from the main cluster that was highlighted in that map that we should not be considering here.
Thank you very much. Let's take the next one from Makochi of the BBC. You have the floor.
Yeah, hi. I just wanted to confirm, as Ghana has, as a case has been confirmed in Ghana, is it the clade 1B or the clade 2, which is quite endemic in the region? Just trying to confirm. Thank you.
Thank you. That's a question for the DG. Over to you.
Yes, I want my colleagues from MST to respond because they are working on that. Dr. Ngashi and colleagues.
Yes, thank you very much, DG. It's too early. I think we are following up. The sequencing is underway right now. As soon as we have the confirmation, we'll share that information. I think for now, we are still waiting. There's confirmation of diagnosis. Sequencing is still yet to come.
Thank you very much. Let's take the next question from Carmen of Politico. You have the floor.
Thank you so much, Margaret, and thank you so much for doing this. So if you could bear with me, I have a few questions, so hopefully I can get them in and get answers. For the Rwandan Health Minister, thank you so much, sir, for being here. There's a lot of obviously interest and concern about the outbreak. I was wondering if you could confirm that the antiviral that we're talking about donated by Gilead is remdesivir. And are you already treating some of the people who have been confirmed positive with it? And is that as part of a clinical trial? Could you talk at all about that? And then the second question on the Marburg outbreak, I was wondering if you could shed some light about the story. So what I've seen so far reported, and I'm not sure how accurate it is that the wife of the first patient that died traveled to Belgium and stayed there before her husband died. And then the WHO said that she had completed the 21 days of observation and she is, fortunately okay. So does it mean that, since you only confirmed the outbreak 7 days ago, does it mean that she knew at the time that she had been exposed to this virus, and, that the Belgian authorities knew early on that she was a contact of a person? There's been a lot of sort of like confusion about that. So I was wondering if you have any more information to shed light about what happened there. And then to Dr. Kaseya, I basically have the same question as last week about the money from the US. If you got any more details about, how much of the 500 million is new money, and any more information about when is it going to start coming, to the Congo or to other places that are impacted. And on the vaccination campaign in the Congo, I saw some reporting yesterday that it had been delayed because I know the announced date was October 2nd. So I was wondering if you could talk a little bit about when it would actually start, if you have a confirmation of a new date. Thank you so much.
Thank you. Let's take the first responses from the Minister. Over to you, Honorable Minister.
Great. Thank you, Carmen. Gilead donation that we expect, and for which actually AfricaCDC Director General mentioned or talked about, we expect around 5,000 doses of remdesivir, as you say, for emergency treatment of patients that are highly in need. For the contact tracing involving a partner of the case that we investigated who lost life, and the partner traveled to Belgium. It's true that we've been in contact with health system through the international health regulations of Rwanda and Belgium. And that happened after the Marburg was confirmed, and which was after the wife had traveled to Belgium. And the follow-up that were done by our colleagues in Belgium, we've been on daily follow-up. And the final confirmation you mentioned, WHO has also reported about, is that the case of the person was not symptomatic and has completed the follow-up period, which was our role to make sure at international collaboration, whenever we see a risk, we communicate and work together. So these are the two answers I can provide to your questions. If there's anything you can add, I'm happy to provide. Thank you.
Thank you, Honorable Minister. Over to you, DG, for the other two questions.
Yeah, before answering this question, we need to recognize that Rwanda is applying transparency. And this is critical when we have this kind of outbreaks. And this transparency is helping us, not only in Africa, but in the world, to know how we can work together to stop this outbreak. I think this is something that is commendable, and we have to put it clearly in our report. Regarding the funds from the US government, yes, as you know, in New York, we had many meetings with US officials. The first one was with the Secretary of Health, Xavier Becerra, and we, with all principals from the USG entities like USCDC, PEPFAR, and others. We discussed with colleagues from the White House and also with Antony Blinken, the Secretary of State. What we can say about this money, we know that 60% of the $500 million are new money. It means we are building on 40% that will be repurposed and 60% that is new. And we are working now, I think there will be a meeting on Friday, that is tomorrow, between AfricaCDC, WHO, and the US government. WHO AfricaCDC as the co-lead of the IMST to discuss about the allocation of this funding. But in parallel, we have some meetings with USCDC and other entities involved to see how we are aligning ourselves and make sure that we use this money efficiently. I will stop by saying on the vaccination in DRC, yes, there was a delay, I think a 2-day delay based on the official communication we got from the government. And I'm informed that it will start now on the 5th of October. The main reason was the delay on trainings of health workers and community health workers. As you know, there are many regions affected, and they had to synchronize all of these trainings. In addition to these trainings, we have also some logistic issues But we believe that we support that all of us we provided to the government of DRC on the 5th, the campaign will start. Over to you, Margaret.
Thank you, DG. We're now moving on to the next question from Anthony of Bloomberg. Anthony, you have the floor.
It's fine, thank you. It's been answered. I was asking about the Gilead antiviral, so thank you very much, Minister. You replied to that question.
Thank you very much. Let's take the next one from Marv from The Telegraph. Marv, you have the floor. Marv, can you hear us?
Oh, hello. Sorry, can you hear me?
Yes.
Yeah.
Yes.
Hi, sorry. I have a couple of questions. My first is, in the DRC, do we know how many health workers specifically have been infected and died from Mpox? And then my second is on Marburg, and I just want to know where discussions stand on trials for the Marburg vaccines, and what candidate is being looked at, and how soon vaccines could be rolled out. Thank you.
Thank you. Let's start with the trial question from the Honorable Minister. You have the floor.
Well, thank you. On the vaccine, as I said earlier during my presentation, we are aiming to start within days. We have not a final delivery date confirmed. That's why I'm saying it could be soon, within this week, or probably next week. But the fastest, the earlier for us, the better, because we are talking about saving lives of healthcare providers. So in terms of the type of vaccine we're going to use, I think it's, I would probably will communicate once we have launched it, given the protocol and our partners' agreements. So allow me to not mention it right now, but should be very in the next few days, we should be announcing that.
Thank you. DG, over to you for the next question.
Yes, Professor Nikes, who was even in the eastern part of DRC last week, can answer that question. Nikes, over to you.
No. Thanks so much, DJ. The cases, at least among the healthcare professionals, we have seen that there is a decline over time. But currently, the data that we have from the line listing, it's 49. Thank you. Over to you, DJ.
Thank you very much. Let's take the next question from Helen from the start. You are allowed to speak.
Thank you very much for doing this, and thank you for taking my question. Well, a couple of questions, if you don't mind, please. For the health minister, please, in your answer to the woman from Health Policy Watch, you were describing the way that the map of showing the various health units that had been involved was misunderstood, that there wasn't a case near Goma, that it was just a contact who had gone to the area near Goma. Can you tell us, did that person test negative, or is that person out of the incubation period? Or I'm just wondering if there's still a possibility there might have been transmission there. Another question I would ask is, there were a couple of cases that didn't seem linked to the chains of transmission, a student and a farmer. Have you been able to figure out how they were infected and related to the rest of the outbreak? And if you could tell us the protocol for the vaccine trial, is it going to be a ring vaccination trial? Could you explain a little bit about it, please? Thank you very much.
Thank you very much. Over to you, Honorable Minister.
Thank you, Helen. Yes, about the district affected and the contact tracing, I confirm that the person we traced up to the border with DRC was a contact from the main cluster, and also had other contacts that he encountered throughout the journey. Was followed and tested, and B also was tested positive. But there have been contacts that were around 30 that were tested. So far, they are all negative, and there hasn't been any other links to that. And of course, we have to complete 21 days of follow-up until we get everyone that was a contact cleared. In terms of the student and the farmer, the student happened to be also in the field of biomedical, who was working at one of those hospitals that were affected, closely linked to that. By the time we were starting investigation, that linkage wasn't established. For the farmer, I would say that the exercise is still ongoing in terms of linkage. And because we have to establish the sequencing and matching, that is something we haven't concluded. And again, it comes to the question asked before on the indexed case and where this may have started. So we'll be learning more as we move forward. Thank you.
Thank you very much. Let's take the next one from Paul of the Lancet. Paul, you have the floor.
Yes, thank you very much for this opportunity. Honorable Minister, what is the approach to surveillance, especially to address international spread? There is news in the media around suspected case in Germany that has tested negative. So what is the policy at the moment regarding international travel? Probably Dr. Kaseya can also provide insights on what the AfricaCDC is advising regarding guidance on international travel for this disease. Also, if you can, Honorable Minister, if you can also give an estimate of the people at risk of potential projections regarding insight into how big this outbreak can be, and the capacity to be able to put these under control. What specifically does Rwanda need to be able to put this under control? And my last question has to do with the turnaround time for testing. Considering this is a rapidly spreading disease, how quickly from point of sample collection to reporting can we find? And I think Rwanda is one of the African countries with extensive genomic sequencing capacity. So why are we not having quick information around the genomic epidemiology of this disease? Thank you very much.
Thank you, Paul. Over to you, Honorable Minister.
Thank you, Paul. These are very good questions. Of course, like others we received, but very technical. But first, on the what are we doing to make sure there are no infections or cases that getting out of our control to other places. So we've put in place mechanisms to extend our contact tracing and making sure we quarantine and test them on a regular basis. And also there is travel screening at point of entry and travel notice that is also actually today is going to be issued in terms of the screening in country before that has been intensified for people who are exiting Rwanda, traveling outside, to make sure there's no suspected case, any case going from here. And this is important for us because it explains also why we're here and why we have to work together as a region and as a continent, that we don't get any exported case out of our continent. There have been 2 alerts so far. We talked about the case that traveled to Belgium. There is also the student you mentioned, Paul, that was in the news yesterday. The student who were practicing in a teaching hospital in Kigali, who was in the same hospital where Marburg case was confirmed doing an internship. We've been following that case for since the beginning, and was among contacts, all the hospital staff in general. And they all on 30th of September got tested, and they tested negative, himself included, and they're also isolated, quarantined, including himself in an apartment where he was staying with other fellow students. The decision to travel after a negative test, and also the communication to our colleagues in Germany for international health regulations, have been done in accordance to international health regulations. And we've been exchanging on this case, and once they tested him again negative in Germany, they quickly notified us, which was also a good thing to appreciate that we are sharing. But in addition to that, we've intensified our exit screening for symptoms. Of course, there have been thermal camera on our point of entries, but also for anyone who is still in incubation period, even if the test is negative, would be requested not to travel until we rule out all possibilities. And that is ensuring in terms of not allowing any case to travel our borders or by air from Rwanda to other countries. How big is the outbreak? I mentioned so far we've exhausted contacts for 400. And we've gone beyond the close contacts to make sure we don't miss any case. And we could see that is a cluster. It's one cluster that I explained that we are following. And the positive case we are reporting daily are coming from the closest contact within the hospital, and specifically in one department, which is actually very critical, the intensive care unit, which, as you understand, with resuscitation and CPR they conducted on the patient who had the first case or the contact of the first case that we started actually understanding as probably the index case or linked to index case. That's where most of our ICU nurses and doctors were mostly infected. And this remained our core of contacts of cases, and we don't see an extension beyond that. But we've done extra measures to screen everyone in the country with high fever, headache, and muscle pain, and all related symptoms to make sure we don't miss any case. As you understand, in a region where you have disease like malaria, you are screening everyone who has that kind of definition. But it's better than missing one case, which could potentially be starting a new cluster. But so far, the cluster is one. That's where we are tracking. And also one case that I mentioned, with the farmer that I think Helen asked before about the linkage. So I would say the epidemic is still that size and is still controlled but not yet contained. We're getting more and more to know exactly in terms of testing. We've focused more on PCR testing. So we get the quickest turnaround time in terms of hours, 8 to 10 or less. This is our aim. But the more we collect samples from a community surveillance perspective, the more our labs are being stretched. And that's why having rapid diagnostics could make it easier. But we have to continue to expand our PCR capabilities until we have these rapid diagnostics. And sequencing, as you say, yes, we've been building sequencing and the genotyping capacities in Rwanda, but the teams have been doing more into getting result, knowing who is positive. It's a 24/7, and we don't want to miss any case. But simultaneously, we are also having these sequencing teams also starting to get to some linkage, which I promised we will be sharing as we know more about this outbreak. Thank you.
Thank you, Honorable Minister.
Margaret, maybe just to add on that, we are fully supporting the protocol that Rwanda is implementing by screening everyone with symptoms that can be associated to Marburg, because we really need to avoid transmission at community level. And we know the minister and the government, they are doing their best to ensure that in the context of malaria, they are testing. And our role is to provide support for kit tests. And we don't want to see Rwanda being in a situation of stock out of kit tests. Another one is about the PCR capability. Because we don't have a confirmed rapid test, we are also providing support to Rwanda to decentralize the PCR capability and to ensure that all regions and even sub-regions can have this capacity to test quickly when it's needed. Back to you, Margaret.
Thank you, DG. Let's take one from the chat box. Edmond from Kigali asks one question to the minister about now that Marburg there's an outbreak of Marburg. What does that mean for the Mpox threat? Is that gone or is that still occurring? The second question goes to Dr. Kaseya. What is AfricaCDC doing to deal with outbreaks on the continent, apart from the international support that AfricaCDC is receiving? Let's start with the second question for the DG, and then we can move on to the Honorable Minister. Over to you, DG.
Thank you. Let us quickly say that all of these outbreaks are just a true reflection of the weakness of our health systems, of our surveillance systems, also of our lab network. This is the starting point, because we could easily contain a number of these outbreaks if we have strong systems in place. Second, all of these outbreaks are also a true reflection of lack of medical countermeasures manufactured in Africa. Because every day when we have an outbreak, it's a panic mode. We start to look for where we can find a dose of vaccine or a specific diagnostic, mostly from Western countries or Asian countries. What AfricaCDC is doing is to continue to build the system. While we are responding to Mpox and now to Marburg, you will see mostly the response plan, the pillars of response plan are almost the same. And what we are doing is to ensure that we are establishing strong mechanisms. We are building capacities of the health system and the surveillance system to detect, to prevent, and to respond to any kind of outbreak that we can have. You will see we are supporting the local manufacturing agenda. I think in my presentation, you saw that CEPI is providing around $270 million to expand the capacity of BioNTech in Rwanda, but also to support tech transfer in other countries that have capacity to manufacture vaccine and diagnostics. we are also building capacity of health workers and community health workers, because outbreaks start at community level. And today, like in Rwanda, if we have a community health worker well trained on case definition of Marburg, of Mpox, and of any other outbreak that can be present in Rwanda, that can help to quickly detect and contain the outbreak. I think these are major support areas that AfricaCDC is providing to countries. And to do that, and we are clear on that, we don't want to duplicate. We don't want to see partners not coordinated. And our role is also to coordinate the support that all partners are providing to our member states. At country level, it's the minister, as the minister Sabin here, who's coordinating everything that is coming at country level. I will stop by saying we consider Marburg as potentially a regional issue, because, as the minister said, we don't know exactly where came this case, the index case we are talking about. Is it something that came from a neighboring country? Is it some, we really need to strengthen the capacity of all our countries by knowing that Marburg as Mpox can quickly become a regional, a major regional issue. This is why our colleagues under IMST, they will start, they already started to work on that and to see how to provide a regional response to Marburg as we are doing for Mpox.
Well, thank you. The question on, we have Marburg, we have Mpox. Are we dropping Mpox and focus on Marburg? The answer is no. We are dealing with both proportionally. Marburg is aggressive, it's taking lives, is spreading and affecting, I would say, our healthcare workers. As I said before, more than 8%. Someone asked in the chat if it's 8 or 80, so it's actually 8%. It's the majority, and that's why the cluster of our focus is there. But also, it has an implication in terms of affecting our healthcare system. In terms for those people who are supposed to be caring others now becoming sick. So we have two teams. We divided our response teams into two because they have different response mechanisms and they are affecting different populations, and that is also stretching our health system capabilities. But so far we are doing well, I would say. We've also our partners whom we thank for coming in and support. I would also mention that for any outbreak, the best tool to end an outbreak or a pandemic is to have vaccines. And for Mpox, we have vaccines that are proven to work. And that's why we were the first country on the continent to move quickly. But unfortunately, we had only a few doses. We deployed this within 3 days, and they were finished. So we expecting additional doses. It is delaying. It is taking time. I know so many efforts have been made, but we have also to mention that global bureaucracy in terms of supporting emergencies has to be revised, because the lessons we learned from other outbreaks shown again in this fresh situation. And for Marburg vaccines in trial that are advanced, we talked about it. We want to go fast, and we will be running two together until we declare both ended. I thank you.
Thank you, Honorable Minister. Let's take the next one from Saima. Saima, you have the floor.
Thank you, Margaret, and thank you everyone for being here. I have two questions. First of all, Honorable Minister, you mentioned that you're screening everyone who presents with high fever, muscle aches, etc. I was wondering if you have an estimate of how many PCR tests Rwanda has done to control this Marburg outbreak. And second of all, disease outbreaks are becoming more common. You mentioned some actions that are needed to make sure Africa is able to respond effectively, like building up diagnostic manufacturing capacity within Africa. Is there anything else you're learning about the kinds of resources that Africa needs to handle the increase in disease threats that the whole world is now seeing?
Thank you. Both are very good questions in terms of testing capacities. The testing capacity in Rwanda is increasing. We've done so far more than 1,000 or close to 1,000 tests. And as we speak, we are collecting more than 2,000 samples from everyone who had presented high fever, headache in the country or in all facilities. And if I had more lab capacity, I've done even more. And that's why my call previously with Dr. Jean Kaseya supporting and committing to extending our lab capacity. PCR takes time, and there is no way you can do massive screening with only PCR, but we have to stretch the system, and we have to make sure our lab teams well trained. Testing Marburg is not similar to testing Mpox. The biosecurity level is different, and that's why we're expanding at the same time we take necessary cautions to make sure we don't expose the lab scientists or also anyone who is handling these samples.
Thank you, Honorable Minister. Let's move on to the next question from Michelle. You have the floor. Michelle, can you hear us?
Hi.
Michelle, can you hear us?
And do you hear me?
Yeah, we can hear you.
Okay. Okay, thank
Excuse
you.
me.
Thank you very much. My question suggestion is that till now we have, first I'm present myself, I'm Michel Vaner, I'm Dr. Michel Vaner, I'm from Médecins Sans Frontières. So till now, we have discussed on a human point of view, and it's very important for sure. But if we take the aspect on one health aspect, we know that Marburg case have historically been reported among miners or travelers who visit caves. And I know that in Rwanda you have some case, some cave that are open to the public. Do you plan to have some sampling of the guano of those caves to be sure that there is no the virus is not in the butt of those caves? It was just a question suggestion, and I know the priority now is the human being, but maybe it's good to have also this preventive aspect in mind. Thank you.
Thank you very much. Over to the Minister.
Thank you, Michelle. This is part of the search of assessing where this virus came from. We have a team working on samples, humans, tracing even up to antibodies testing for those who have probably recovered before we even confirm our tests. We're expanding at that level. That is one pillar. On the other pillar of One Health, because this virus can come from bats and also from primates, we have also a team working on One Health aspect. They are all working on collecting samples and assessing these specific bats that may be transmitting or hosting this virus before they get to humans. So that's why I'm saying it is taking time. It's not just taking sample and sequence. It's also putting together all this information. But I want to confirm that, yes, we are also working on that pillar and that search aspect of One Health. Thank you.
Yes, Margaret, quickly on that, let us share with our colleagues that Africa is committed to implement One Health approach. During the negotiation on pandemic agreement, we saw some comments saying Africa doesn't want One Health approach. That is not true. What Africa wants, and we are still sharing that with our colleagues because there is ongoing negotiation in Geneva. We want our partners to understand that we need to put at the same level the three components. It means the environmental health, the animal health, and the human health. And you will see that a number of outbreaks that we have today are mostly zoonotic disease. When we talk about Mpox, when we talk about Marburg, and if you consider also other outbreaks that we are experiencing in the continent, I think the message is clear. We are working to implement One Health. Each country has its approach. Some countries, they have a governance mechanism under the president, under the vice president, to bring all ministers together. But clearly, we are moving, and what the minister is saying, Rwanda also is moving with One Health approach.
Thank you, DG. Let's take the next one from Kai. I can see your hand. You have the floor.
Thanks. I just wanted to ask a follow-up of the minister, if I may. And so in the WHO press conference, which was going on at the same time, I just asked about the date of death of the index case, and I was told that it was on the 8th of September. So I'm just trying to understand the timeline a little bit. Could you just talk a little bit about, at what point these samples were tested, how long it took, when was it actually confirmed that it was Marburg? And I assume from what you said earlier that maybe the malaria diagnosis might have complicated things as well. Just trying to understand the timeline a little bit for the outbreak, and also any information about where the index case actually came from. Thank you.
Thank you very much. Over to you, Honorable Minister.
So thank you, Ka. I may not speak about what has been said in another conference, which I wasn't attending, but I will be speaking on what we know, what we're doing. But this virus was confirmed last week. It's exactly 7 days. And once we saw it, and it was based on information that were being reported from alerts from clinical teams that in teaching hospitals. And that was based on patients that were not responding to usual treatments, presenting symptoms, as I said before. And with our PCR repeated, and we got to know this is the virus. I extensively explained this. And within 24 hours, we had issued the communications. And that triggered going back. There's some information whether this was suspected, and going back and back, we discover a lot of information. But also we have to be aware that some confusions also may be there. Some fear. Everyone who passed in a situation of malaria may think, oh, maybe that was this one, that was this one. So I would not go into that level of speculations, and focus on the surveillance mechanism in place so that we get the right information instead of confirming information without enough search, enough facts. And that's what I can say for now. But I can't speak about WHO press conference, which I didn't even know was happening. Thank you.
Thank you, Honorable Minister. We are going to end the conference at 31st. I am going to take, I think, 2 more questions before we end the conference. Anthony, I can see your hand. You have the floor.
So that's my error. I should have put it down. I'm fine. Thank you very much.
Thank you very much. Let's take the next one from Carmen. You have the floor.
Sorry, Margaret. No, I forgot to lower my hand. Sorry about that. I'm good. Thank you.
Right. All right. Let's take the next one from Emmanuel. Emmanuel, you have the floor. Emmanuel, can you hear us? Okay, I guess Emmanuel is not there. Let's move on to Genevieve. I can see your hand. You have the floor.
Thank you. Thank you so much. I wanted to just have a question for Dr. Kaseya. If you could elaborate on the funding distribution that you had mentioned for the manufacturing of the Mpox. Would it be for technology transfers for local manufacturers? And is there an indication on the demand and stockpile requirements? Thank you.
Thank you, Genevieve. Let's take the last one before the DG comes in. Paul, I can see your hand. You have the floor.
Yes, thank you. Thank you very much. I just have a quick follow-up for the Honorable Minister, which is on the clinical trial for Marburg. Sorry, can you give information on which candidate vaccine you are looking at in testing, and how far has that gone? And considering there is no emergency listing for any Marburg virus vaccine from the WHO, what is the guidelines regarding securing approval for it? And I know Dr. Kaseya has said some time ago that this emergency listing is a major obstacle for quickly rolling out vaccine candidates on the continent. So which vaccine candidates are you using, and what is the regulation guidance at this moment? Thank you.
Thank you very much. Let's take the second question for the Minister before we finalize with the DG. Over to you, Honorable Minister.
Great. Thank you very much. I had answered to this, but I'm happy to come back. That we've opted for a protocol for vaccination for this trial that will allow us to catch up with time. Fast track, rapid protocol, but also fulfilling all the requirements. In terms of the name of the type of vaccines, I say that this will be announced in the next few days. So I don't want to be in a situation that we provide specific names before without our partners on board here. So but I promise that this will be shared in due time. Thank you.
Thank you very much. DG, over to you for the other question.
Yes, to complement first the Minister, we have to say that we are exploring a large number of opportunities in terms of vaccines, in terms of therapeutics and diagnostics. We have ongoing discussions with a number of partners, and I agree with the Minister. We don't want to give some names if we didn't finalize all of this negotiation. But I think next week on Thursday, we'll be able to provide more information on that. In terms of funding for local manufacturing for Mpox, let us agree that we are using all opportunities to build our capacity in Africa for local manufacturing. And we need to start somewhere. And also, as you know, we have this 100-day mission from CEPI. When there is an outbreak, a major outbreak, we need to have medical countermeasures ready, especially vaccine. And with that spirit that we launched the BioNTech in Rwanda. And what we are doing with funding that we have is to go to local manufacturers first to ensure that they have capacity for tech transfer, for manufacturing, and also to support the market side. When we talk about market, we talk about the demand. Yes, we have the demand, and our team, the IMST, the incident management support team, it means AfricaCDC, WHO, UNICEF, Gavi, they are working together on that demand side. I can say, as mentioned by my colleagues, we need now to vaccinate around 10 million people. It means we need more than 15 million doses. And when you need more doses, we need to think about how we can get these doses from Africa. As you know, it was made official. One dose is around $270, and we cannot afford that in Africa. We need to reduce the price by manufacturing this vaccine in Africa, and we need to increase availability of this vaccine. And I think I respond to your question, and that is also related to Marburg, because we don't want to see a vaccine against Marburg that will cost $300 per dose. That is not sustainable for us in Africa. I think the way we are taking it is really using all opportunities to build our capacity and capability in Africa. Over to you, Margaret.
Thank you, DG. And with that, we've come to the end of our press briefing today. I'll give the floor to the Honorable Minister for his last word before the DG can close. Over to you, Honorable Minister.
So I would like to thank Director General AfricaCDC for inviting me to join this press brief. And I also thank all the colleagues from different media houses and institutions that joined. I can see more than 400 connected. That is something we really need in terms of these kind of outbreaks and pandemics, that we share what we know and will continue. And the only way we can end this kind of outbreaks and even strengthen our healthcare systems is to work together as a community, leadership, scientists, and also media. Communication is a strong power to fight miscommunication and infodemics. And I hope that what we provide today was useful, and I'm happy to continue responding to your questions through other platforms of our Ministry of Health in Rwanda, and we continue to update you and post as we know this outbreak evolve until we end. So thank you so much. I look forward to see you next time.
Thank you, Honorable Minister. Over to you, DG, for your last word.
Thank you so much. Let me first thank the Minister. It's tough time. He's so busy, but he took opportunity to speak with the media. Let us also thank the media. I think you are supporting Africa to better manage all of these outbreaks by providing appropriate information to our communities, but also to our partners. Let us also recognize that we see Africa taking the lead on the way to manage all outbreaks today. This is new, and this is thanks to the mandate that our head of state they gave to AfricaCDC. And we are supporting our member states. The minister is saying he's so glad to be invited. He's not invited, it's part of that. Any minister, any country that will be in a situation of outbreak, this is the platform for them to also address the media and community, international community. I think, as we said, our colleagues working together under the incident management support team, they are handling this issue. Next week, they will be, I will be in Rwanda, meeting the minister and all partners, and I will be supported by colleagues from the IMST and to see how we can quickly provide necessary support to Rwanda based on the response plan finalized by Rwanda. And it's also an appeal to media to start to share that when the response plan is ready, we want our partners to be ready to support Rwanda and to stop this outbreak that can quickly become a regional and a continental issue. We will meet again next Thursday. We hope the minister will be with us because this is a large platform to share an update on all pillars of the response, either for Mpox or for Marburg. We hope not to have another outbreak in the meantime, because with this all of these outbreaks that we have, we are already so busy. But we believe with the support we are getting, we can strengthen our system to stop seeing Africa being every day threatened by so many outbreaks. We thank all of you, and we will meet next week on Thursday to give you more update. Thank you, Minister. Thank you, colleagues from the media.